Okay, I'm a KL boy who's married to a Sabahan lady for 44 years. I do understand education in Sabah in certain areas are so difficult. It's very true. Some students have to climb up the trees to get a Wi-Fi across rivers and mountains through to 3 to 4 km. I sincerely think education is key in all developed countries and developing countries, or all countries of the world for that matter. But of course, we must have good leader with good allocations of funds, move into educations, and education is not just for the doctors. I always say to the patients, the most important thing is the best doctor for the patient is you yourself. You must have something to know about your own health and your family health. So don't rely everything on the doctors, because the doctors don't have all the time for you. So it's important to understand that awareness is not only to education, it's not only to the doctors to treat the patient. The other part will be the patients themselves. So this requires KKM to do their part to come up with more education. One of my previous meetings with the ex-health minister was that it's high time to give education to the public on certain days. Let's say liver days, 8 days, autism days. This is the time where they have to focus. I believe this is the way to go. At all times, I always believe the improvements of a country depends on good leadership. And we should move into that level. Thank you. I always say prevention should start at 30. And not in the later age when you're sick, you go to the hospital. So the more time you spend in the hospital means the government will have to incur more costs for you too. So education, awareness towards prevention. Longevity can only be extended if you extend the health span. And health span all depends on the cell span. This is the way to go.